Hello, today I'm going to be talking about the PRP ACell regimen we use for hair loss or to improve hair growth or to help strengthen and nourish the hair. So along with several other regimens, both something you take by mouth and then some external treatments, I think PRP has now been a huge part of our practice. And I want to kind of explain to the patient what they can expect when they come in for a PRP treatment. So a couple of things to remember is that really it is both for men and women. This is one of those few treatments where we actually have more male patients than female patients because a lot of younger men start losing their hair in their 20s, and then PRP can certainly be a great supplement to what they're already doing. So when we call it PRP, it's not just PRP or platelet enriched plasma. So our nutrient mixture or our hair cocktail consists of PRP, that stands for platelet enriched plasma, and we mix it with ACell, that's an extracellular matrix, and this is really a very important component of this nutrient mixture that we inject along with vitamin D. So it's really these three primary products because these have been shown independently to improve hair strength, improve hair growth, and actually improve the diameter of the hair shaft so that the hair looks thicker, fuller, and healthier. We've now been offering PRP to our patients for nearly 4 years, and we've had extremely happy patients, and I've personally been happy with the results of the PRP. So generally, first thing that happens before the treatment is a patient does come in for an evaluation, and during the evaluation I'm looking to see what their history of hair loss is, how long this has been going on, and what they have been doing actually to treat the hair loss. So a lot of patients have maybe been on Rogaine topically or have been on prescription Propecia. There's some women who've been on spironolactone, and now with the new supplement called Nutrafol, some of them have also been on Nutrafol. So certainly with this new addition to the continuum of treatments for hair loss. So I'm going to say, in and alone, this is not an end-all or a final result, but certainly this is a great step to help prevent hair loss. I also have patients who've been who are going in for hair transplant and will start doing some PRP such that it'll maintain the hair that they have and help their transplant hold on better, and they'll have a better result with the transplant. So certainly, so once we've decided that the patient is a candidate for the PRP treatment, we decide whether they need what we call 1 vial or 2 vials of PRP, and then most patients will need 1 vial if they have a small area. That means an area that's about maybe 4 by 5 inches that need to be treated. If it's anything more than that, then you end up needing 2 vials. So most of our patients end up needing 2 vials unless it's a patient who just needs maybe the hairline done, a very small part of their scalp treated. So the first thing we do when they come in that day is we have topical numbing cream that's applied to the scalp, and we use a mixture of betacaine, lidocaine, and trachecaine that's been formulated for us by compounding pharmacy. It's actually quite strong and works very well. We have the patient relax with that first, and we apply it over the areas that need to be treated. Then we actually draw out their blood, and we use a very fine butterfly needle to draw out their blood and into the syringe. And usually if they need two PRPs, they usually need over 20 cc's, and the PRP we use is the Eclipse PRP. So usually it's about 2 vials of the Eclipse is what we draw out when someone needs a PRP. With that, this is really important. We mix it with ACell. This is a mitral matrix. It consists of extracellular matrix from a pig bladder. So what this does is it has all the components of the pig bladder. That means the cellular level, what's called the basement membrane level, the mucosa level. And what we've noticed is that when it's injected in an area like the scalp, for example, for hair loss, that it makes the hair cells and turns the hair cells on, so even the microscopic hair cells, that is the hair cells that now, the hair follicles that are now slowly regressing, will start growing again. And there have been studies that show that it has regenerative properties that's actually making the dormant hair follicles alive. So this is a super important component of our cocktail. And then the third ingredient we actually add is vitamin D. And this is also injected into our nutrient mixture. And this is injected into the scalp. Generally, for 2 vials, we use the entire vial of the micromatrix, and that consists of 100 milligrams. And then we end up using 10,000 units of the vitamin D. That's basically our mixture. And then once everything is prepared, the PRP that is drawn out and achieved, obviously this is a centrifuge that we use to centrifuge our PRP, and once we get the PRP, we mix it, as I said, with the ACell and the vitamin D, and that's injected into the scalp. With the injection, it does hurt. The scalp is sensitive. There's not a lot of soft tissue underneath it, so the injections do create pressure and tension, and so it does hurt when we do the injections. So a couple of things. We have patients use Pronox. We found the Pronox is amazing. It is a mixture of oxygen mixed with nitrous oxide or laughing gas, and so it makes the patient a little bit high while we're doing the treatment. So it helps with them tolerating the treatment well, because once we get this entire mixture together, the treatment itself is very fast and efficient. We want to go fast because we know the patient is in pain. We don't want them in pain, so we want this done fast. So it usually is less than 10 minutes. The treatment itself lasts less than 10 minutes, and we go quite fast and efficient with this. And so we have the patient breathe the Pronox, and it makes the treatment much more tolerable. Once the treatment is done, the pain is greatly diminished, because once it's done, you hardly, it may feel a little bit sore, but really quite tolerable. And the best thing about the Pronox is that the nitrous oxide leaves your system within 10 to 20 minutes. So what that means is it is very safe for someone to even drive home or to go back to work in 20 to 30 minutes after the treatment is done, and they can resume, mentally, they can resume activities. So instructions after our PRP injection to the scalp is we usually recommend lots of icing for that first day afterwards. I usually recommend no exercise for 24 hours, and then I have them wait till the next day to shower, and that's it. Those are basically the instructions. Most people find that it's a very tolerable treatment, and our usual regimen is 3 treatments 1 month apart. And after that, a patient would come in maybe every 18 or 24 months for treatment to maintain the results. So good luck with your treatment for the PRP, and hope to see you in a few weeks. Bye.